Fair. Scott Stoller is the general manager and has been since April of 2018. He served as the CEO of the Silver Dollar Fair in Chico in California prior to that. And before being in Chico, Scott was the general manager of the Benton County Fair and Rodeo in Corvallis, Oregon. Thank you for being with us, Scott. And I know you have big news to announce tonight.
Yeah, you still get the pronunciation of Corvallis incorrect. We'll work on that.
You know, that's how I learned it. So when I lived there, that's how I learned it.
Can you pronounce the name of the river that flows through it? Because that's the one that people butcher. Oh, it's Willamette, so just FYI. All right, I'll get more serious. Sorry, it's been a crazy day. Like most of you, we've had to have some pretty serious conversations at our board level about what our fair looks like. And today we had our board meeting to define what the 2020 State Fair looks like. While we didn't vote to cancel the State Fair, we did vote to strip it down to its core. We canceled all of our entertainment. We canceled all of our other contracts, all competitive exhibits at the fair, aside from 4-H and FFA programs, and some of those are still being worked out. So we hope to host those, but we didn't make any guarantees today as to what the State Fair would look like. We know that the County of Pueblo has a variance for up to 175 people outdoors in areas today. We don't know what that looks like in late August. So we took the approach of strip it down to its bare bones. And as we get closer into July and August, and the health guidelines are nearer to us, because today's guidelines are not going to be what July's guidelines are not going to be what August guidelines are going to be. We have the flexibility now to go forward with our 4-H and FFA programs. Hopefully things are looser and we can bring in more people, but we also have the flexibility in our plan if we have to where we can tighten up and we can do a hybrid model where we spread out more on the fairgrounds, or we even do a virtual shift, which that's the worst case scenario, to get the numbers low enough to where on site we're still able to be in line with public health. We are wanting to have other activities on the fair, like a drive-through food court or an on-site food court. We want to have maybe some limited carnival, but all of that is stuff that we stripped out today, with the idea as we get closer, we can hopefully add some of these things back in. But for those of you that have seen the news or were on the board meeting today, the real goal is to preserve what people believe fairs to be, as common knowledge, and that's to support the 4-H and FFA programs. So that was our main goal going forward. Don't know what the fair is going to look like this year. We use the term reimagined just because we didn't want to say canceled, because we're still going to be doing some components. It's definitely not going to be the State Fair that you've come to know and enjoy. It's going to be very different, whatever form it's in this summer. And we're in a position where we made a decision to where we're going to be vibrant and healthy in 2021. Hopefully, that's the year we can come back and all have the fair we're used to. But we're also in a position to hopefully be able to weather 2 years of bad news. I don't think that's anything anybody hopes for, and nothing today was done. No decision was made today out of will or want. It was out of necessity and reality. We're all facing the same circumstances, so we had to make that difficult decision. And I know it's a little confusing out there because it's a fresh message. Hopefully over time, our message will get sharpened on exactly what a reimagined State Fair looks like.
Does anybody?
Yeah.
Does anybody have any questions for Scott for the State Fair? We have, when you mentioned hybrid, what might that look like, Scott?
So like I said, and I'll go through the list of the protected competitions because everything else was pretty much axed today. The competitions that we plan to host this summer are the 4-H and FFA Junior Livestock Show and Sale for the sheep, goat, swine, and beef. We will not be having rabbits, turkeys, or chicken competitions. We'll have the Catch a Calf program that's a partnership with National Western. We'll have the FFA Wrangle, 4-H Horse Show. These are all things that the board is committed to financially to host this year in some form. The 4-H Dog Show, and these are things also if 4-H, they have a lot of work on their end to make sure that these are feasible with their, with their higher ups and whatnot. So we are happy to host if it works out. So 4-H Dog Show, 4-H Rocketry, the 4-H Shooting Sports is canceled at the state fair level. I'm not sure how that plays out at the county fair level, but we were informed that that's something that's not a go forward. But so that one's off the table. Everything that's in the Growing Minds complex, which is in those 3 buildings near the Beulah Avenue entrance, that's your woodworking, your leather craft, your presentations, there's some baked goods in there, all that good stuff. We'll host that if it works out for 4-H. I think that's it. Everything else, we have not made any commitments to hosting on site. So I see open class. There would be no open class show this year. We will develop some virtual competitions that look nothing like the traditional competitions at State Fair. They're more whimsical and fun. They're not the pure competition that you're used to. It's more just to keep our spirit alive and keep us a little bit relevant, though we have some pause about doing too much stuff in social media world just because there's so much of that out there and we feel like it gets lost. So we would be very selective in what we do. In regards to virtual hybrid, if our numbers get down to a level where we cannot accommodate all of the live animal exhibitors that want to participate on the fairgrounds, we would use a new common practice, which is the virtual showing, where kids would submit 60-second videos of their project. We would use our judges to go through and pick out whatever number we're allowed to have on site. This would be 2 or 3 weeks before fair. And then whatever that number is, hopefully we can follow that through to where we can get, say it's 50 per barn or something like that, we would select 50 kids to come and compete at the fair for placement in the livestock auction or the horse show. That would be the hybrid. That's not our best. None of this is best case scenario. With the numbers for today, which, like I said, today's numbers are just today's numbers. August numbers are going to be different. With today's numbers, we feel confident that we could spread out, but we have to work with the health department to make sure that our plan is sound before we can make that full commitment. And that's our July project, is to build those out to where they're ready for review and approval. But our goal would be to do as much on-site as we can, but we also understand reality and limitations.
Thanks, Scott. One question: when and where will you basically post a list of what activities, what all is going to go on? When do you expect that list?
We should have a tentative schedule up, I think later this week. Robin's on the call. Thumbs up, is it later this week that we're hoping to get the tentative livestock schedule up? Tentative, everything's tentative at this point, because like I said, we stripped down. I don't know what the reality is, but we've committed to attempting to host these, and everybody's got to be willing partners. And if we get no entries for horse show, we obviously have to make a decision there. I don't see that happening, but those are things we need to think about. We'll post the framework for our competitions in July, but it's just going to be framework, and it's going to be similar rules to what everybody's used to, with the one caveat that at the end of July is when the limits will be determined as to how we're going to do it, because we need to wait as long as we can. So in our rules, we have till July 31. So on July 30 or July 31, that's when we're going to firm out what the mix looks like. If it's all on site, if it's a mix of virtual or whatever. So our plan is to have tentative schedule up this week, framework up early July, final plan up end of July, with a big caveat: if there's a major outbreak in August 20th, there has to be flexibility, and that will be written into our rules also.
Okay.
You guys have mentioned limited carnival. What does that look like?
Limited carnival right now is a concept. It's one of those things. Right now we're stripped down to no carnival. As we get closer, and if the carnival is a willing partner, and we've had very, very high-level conversations. We haven't dived into the details. But under today's circumstances, it would be 175 people in one space. In theory, it could mean having 4 or 5 different locations, not together, with fenced-off areas where there's a single point of entry and a single exit, where everybody that goes through has to have a wristband for a certain time. But like I said, that's currently concept only. It's a hope that we can pull off. It's achievable in today's terms. Whether or not it's financially feasible for a carnival, he's still thinking about that. And we're not, by no means are we looking for charity this year from people who are already hurting. So if he wants to go forward and it makes sense and public health says it's okay, then it's a go. But if it doesn't meet those 2 minimum barriers, it's not going to happen.
What does this look like financially for the state fair?
It is about $600 and some odd $1,000 burn for us in fiscal year 21. The state fair has reserves for our policy of over $1 million, so we're definitely going to be burning through our reserves to make this happen. But we also have dedicated funds that are supposed to be used for 4-H and FFA. So if we can, we're going to. That's kind of the motto. We're not thinking about making this a profitable venture. We're thinking about, do we have the resources to do it? Will we be healthy on the backside? And will it be safe for the public to participate in? And we have enough reserves that if our modeling financially works out this year, not that I think 2021 is going to be anything like 2020, we could do this all over again next year and still live to fight another day. We could not put on a full-fledged fair and only get 10% of our attendance. That would have annihilated us. So we could not have gone forward knowing that there's the potential that we can only have 175 people come through the gate each day, or less, or right around there.
Do you have an idea of what social platforms you'll be using for your virtual show?
For our virtual livestock show, or for
virtual fair, for any aspect of your virtual, do you have any? So
if we end up that's 2 different questions there, and I'll answer both the way I think I read them. For the cutesy social contest, we'll use probably Facebook, Instagram. My millennials they're gonna get into the younger kids stuff and play with TikTok a little bit, which is hilarious to hear millennials say they're gonna do what the young people are doing. So we will probably play in TikTok a little bit. For the virtual livestock show, we use ShowWorks. So we would use ShowWorks platform for if we ended up having to do a hybrid option with virtual, just because that's what my staff knows and that's what we use.
Do you have any idea of how you're going to control the entrance to facilities or show areas at this point?
We have a concept. If it's just exhibitors, we're going to use wristbands that are color-coded to the barn. So we'll know the numbers that are in there. If it's open to the public, we're going to have some staff. And I don't know if you guys read the CDC guidelines that came out last week. In there, they do say that counting in and counting out is acceptable. And I think CDPHE's draft has that in there, that you can count in and count out. So we would have single points of entry. Another thing we're exploring, and like I said, we're down to the bare bones of what our fair is, and hopefully we're able to add stuff back. But all this is going to be in collaboration with CDPHE and in cooperation with Pueblo County, because we're a little different. We're state, so we have the benefit of being able to talk directly to CDPHE, which usually the county has to, go through. You have to go through the county to have those conversations. But I lost my train of thought. Sorry, I got a ding in my ear. But we're. Yeah, I don't know where was I going. It's been a long day. Sorry.
One more question.
Oh, I was talking about the
here.
controls. I was going to say, we also hope to have guided barn tours that the public can sign up for. That's what I was going to say. So the public could pick time slots and take their family to the barns and do ag education and have that moment. It's not going to be for the masses, but it's going to be available. And like I said, not a profit center. This was just to kind of keep our mission going this year. And everything I'm talking about is in the spirit of the state fair. It's not the state fair that everybody knows, but you know, we want to keep the spirit going this year.
Could you lead into some of the counties, how the counties might get access to ShowWorks? Do you know kind of the cost of that as an idea for these people as a alternative?
There's a couple platforms out there. I don't want to be specific and pick winners and losers. There's Blue Ribbon, there's ShowWorks. I think there's, I can't think of the county fair program, but it depends on what your program is. You know, you're going to have to talk to them directly. We have a lot more robust needs, so our cost is going to be a lot higher because we have more users and whatnot. Fair entry, there you go. Thank you, Connie. Fair entry is the one I was thinking of. But it's all scalable. So if you have one user, the cost is going to be a lot lower. If you have multiple users, it's going to be much higher. And I'm trying to remember, somebody else can chime in on that because I don't think the state fair is the right model to ask that question to. Because like I said, we have a very robust subscription, whereas most county fairs probably don't need the same level of program that we have.
Exactly. All right. Do we have any other questions for Scott in the state fair? All right, Michael. Thank you, Scott, for joining us. Oh, we got one more. If you do go virtual route for livestock, is the livestock office handling all of that, or would extensions have a role?
So we have for livestock, we have our own entry, data entry. So we would process the entry forms. And Robin's on the call. She can talk to this. She's like all of us. It's not really a desire to go that route, but it's better than nothing. But ShowWorks has in it, and we would for this, because the back end to make it happen. They would submit their videos, and then our staff would get the videos to the judges for their selection. But I don't think Extension would have a hand in our scenario. But like I said, we're different than the county fairs. Just, you know, it's hard to, we're apples to oranges here. I don't think we're the right model to go after.
Yeah. Liability waivers for kids that show livestock. Will you be doing liability waivers for anybody that participates due to the COVID?
That's the question we have out to our Attorney General and our risk management folks, but that is a potential. And if you read through the guidelines that are drafted from CDPHE, you guys see that there's a lot of protocols that are being suggested that we all need to think about. That's one you need to talk to with your insurance about. And we had conversations with our procurement folks to make sure that we could make our change the way we did without the financial risk, because not every fair has the same luxury of the state of Colorado to where we have provision 25 in our purchase orders to where we can cancel a contract if we don't have funds. We don't have to have force majeure. We don't have to have other things. Because we're the state, we have a few more protections. So don't use our model blindly. Check with your lawyer to see if you're able to do what we did today. Check with if you have procurement people, and also check with your insurance folks to make sure if you do stuff that you have insurance. So those are pretty important things. And check with your bookkeeper to make sure you have money, because that's pretty important. You know, you want to live another day. People may be grumpy about not doing things this year, but they'll be really grumpy next year when you don't exist. So you got to really think about the legacy that you guys and that we all are responsible for. The ag commissioner, she had a great quote, and I like it. I don't know if you guys will like it or not, but she said the state fair was in Pueblo long before Colorado was a state, and it will be here long after COVID-19 is a memory. So we really have to think that way. We can't just think blinder focus on 2020 being a thing and destroying our future. You really need to think about 2021, 2022, and what's in the best interest of your organization. Sorry, I got a little preachy there, but that's what guided our thinking.
All right. Well, thank you, Scott. We appreciate you giving us an update, and I will turn it back over to Michael.
Thank you, Scott. And if you don't mind, Scott, I had a couple private messages sent to me while you were speaking. Scott gave an example about if we had an outbreak on August 20th or something, there might have to be adjustment. I was asked what an outbreak is. According to Pueblo County's variance, in Pueblo County, an outbreak would be considered 84 cases within 2 weeks, if I'm correct. Isn't that right, Scott?
I don't know the specifics, but I would say that to me, an outbreak is the public health officials telling us that the plan that's approved needs to be modified. So I'm not gonna play doctor or scientist. I'm gonna lean on those folks because that's what they do for a living, and they're the ones monitoring all the data. Sorry, you're probably correct on that. I know Marla will tell you 3 is an outbreak for E. coli, I believe, but I don't know about COVID, and I could be wrong on that 3 number for E. coli.
So our next speaker is my boss, or my boss's boss. Dr. Ashley Stokes is the Assistant Vice President for Engagement and Deputy Director of CSU Extension. She is responsible for food and ag systems initiatives, fostering applied scholarship opportunities, and developing strategies for university-based extension that broaden and deepen engagement across CSU's 8 colleges. Thank you for joining us, Ashley.
Yeah, thanks for having me again. I really appreciate the invitation. These have been really helpful for us as well, and also just really hearing all the questions that you have, and it's definitely been helpful for us as we have been working with CSU and with our system, with Department of Higher Education and others about how we can keep moving forward too and what we're doing and be as supportive as possible. So I would like to say thank you to Scott and the Department of Ag. Jeremiah, thanks for having us looped in as well. Thanks to MJ and also to our 4-H team who's worked really hard to do everything we can to have a great experience this year. And I would just like to echo Scott's comments that we know it's not going to look the same, but what our biggest goal is that our youth have a really positive experience and get the most out of their projects. And so our team has been working really hard. And I know that I have Jean Glowacki on and Sam Lowry is also on. And I know we have many others that are from Extension too. So thanks for being on here too. And they can help me field some questions as we go along. And so a couple of things, I guess first up, we've been in a lot of communication with the Department of Agriculture and with Scott and also with public health and really being able to understand exactly where they're at, what they're considering, making sure that we can all be supportive of each other and that we come up with a cohesive plan. And we've also been working really closely locally with your local public health. And so I think last time that we met, CSU, we were a little more restricted in what we could do. But in working with our local public health officials and with the state of Colorado, and we've been able to now that our programs, we're able to open up a little bit more, do a little more face-to-face, especially as youth are preparing some of their projects. And we're able to follow the county public health guidance. And I know that many of your counties, like some of them have variances. And so whatever it is that your county public health is saying, we're just closely adhering to that. And it's great because it means that we can really be responsive and relevant in each of our communities. So that's really good. We do have a couple of counties that have defaulted to the state's public health guidance. And so we follow that. So, as we move forward, I guess I would also like to just echo Scott's comments because I had written it down too, that we definitely need y'all's help because not everyone really understands that our goal is to have the best experience possible And we do have to follow the public health guidance out of our counties. And so if you can help us with that, I know not everyone understands why we have to do that, but we want this to be possible in the future, and we want people to be healthy. And so, so I really appreciate your support in that as we move forward, and just to help us with that. And it can be a challenge, I think, sometimes, because including me, I mean, I would love for things to be just like they were in previous years, and but it is going to look different. But we want to do the best that we can this year and really keep it positive. Scott mentioned the spirit of the fair, and just that experience for our youth and for families and community members. We want that to be there as much as possible. Yet we also know that we have these limitations that we have to work within. So thank you for that support. It really is meaningful, and it really helps us a lot. You know, if the local public health official, if something comes up and they need to pull back, we have to pull back in line with whatever they say. And so please just understand and just help to be a champion in that, because it's not really our choice in that. We're following that best guidance. So, there was a question about liability waivers, and I'm just going to mention that for youth to participate in our 4-H activities, and Jean Glowacki can go into this in more detail, but we've addressed this as well in having those types of liability waivers and for their participation in 4-H, and also with our volunteers. And so it's important that people understand that risk, and although we're going to follow the public health guidance extremely closely so that we minimize anything like that. But of course, with something like this, you know, there's potential there. So we do have those as well. So I think, you know, all in all, we've been working really closely with our counties, with many of you, of course, that are on here today. Thanks for being on, and with the state fair, with Scott and with the Department of Ag, and you know, and I think we're all moving together really closely, and to make this best experience as possible. And so CSU, of course, we're proud to be a part of it, and we want it to be a great experience, but also very safe at the same time, you know, as much as possible, and maintaining the health of our communities. So I will allow, let's see if Jean is on. Jean, if you wanted to add anything I missed real quick, or Sam.
I don't think you missed anything, Ashley. I just, you know, echo that, those major points, and also to Scott's point, you know, we're all working to reimagine this fair and to create as many opportunities for youth to participate safely as we can. Connie is, you know, working with agents from around the state to think about what would programming look like at the state fair, what would competitions look like. Scott mentioned the, you know, model rocketry and the dog show and the our static exhibits. And so we're starting to think about that and think about ways that we could do that, and how we help the counties to conduct competitions and participation in their county to prepare for state fair. But as everyone has said here this evening, we also have to be prepared that things could change on a dime. But we are moving forward with that hope that that there will be some good opportunity for interaction and participation.
Thank you, Jean.
Yeah.
Thank you, Jean. And Ashley, does anybody have any questions for CSU? A few minutes here for anybody to chime in here. Not really seeing anything popping up. So, Michael?
Thank you, Ashley and Jean.
Thank you, Ashley. Sorry.
Our next guest is Marla Calico. Marla is the president and CEO for the International Association of Fairs and Expositions, also known as the IAFE, headquartered in Springfield, Missouri. The association represents and facilitates the evolving interests of its 1,200 members, which are agricultural fairs, exhibitions, and shows from around the globe. And if you've heard me introduce Marla before, you've heard me say that I always enjoy Marla. She's got this great impact or aspect where she is talking to fairs from all over the world on a weekly basis. So it's always a joy to listen to the other MJ. So Marla, take it away.
Thanks, MJ. Appreciate that very much. Hi, it's good to see you all again. And thank you all so much for asking me to be a part of this. It's always great to hear what's going on with you, what your concerns are, what solutions you have found. You know, compared to our last call, things are still dire for the industry as a whole. It now takes almost 2 full-time people just to keep up on our end of tracking who's canceled and trying to maintain some data that we're tracking as we're frequently asked by the media what's going on. Today, we were up over 400 of our IAFE member fairs have canceled. So we are getting close into that 40-45%, probably another 100 fairs that we're aware of canceling. On the good news front, and actually there is some good news, right before 5 p.m. tonight, I received an email from Angie's counterpart in Ohio, Howard Call. Howard is with the Ohio Fair Managers Association. He's also the manager of the Summit County Fair. And he has built a tremendous grassroots lobbying network of fairs in Ohio. And they worked really hard a couple of weeks, and a couple of weeks ago, the governor announced that county fairs could go forward with livestock shows. And he even announced that the state of Ohio was using money from the CARES Act that was allocated to the state to help those fairs with some of their extraordinary expenses, knowing that they couldn't do the elements, the revenue producing elements. So long story short, they were determined to go ahead, but a number of fairs had already canceled. Today, they got clarification, and for example, on a grandstand show, they can go 50% capacity or 2,500 people, whichever is less. And so they were getting calls left and right tonight of fairs that are rescinding their decision to cancel, and they're going to go forward. Most of the fairs had decided to at least have a junior fair element. They were going to make that happen, but that's pretty good news for the Ohio fairs, and that means that if we can see some get going, it'll be a real test for the industry. Looks like Delaware State Fair is planning to go ahead. They're scheduled to start in just a little over a month on July 23. If your fair is a member of IAFE, we sent out an email today that contained the latest CDC guidance, and I don't want to say guidance, it's considerations for events. And also specifically for equestrian facilities, a really nice document on how to safely open equestrian facilities. So those are both widely available to the public. You can get to them on our website. And then on our members only resources, we actually have the 67-page operating plan that Delaware State Fair has put in front of their governor as their rationale for being able to go forward at the fair. They're not going to have concerts, but they do plan to have carnival rides and free entertainment and their livestock shows. So those are some glimmers of hope for the industry. But I think the majority are doing exactly like what Scott and the folks at Colorado State Fair are doing. There are so many unknowns. And at the end of the day, a fair has to preserve their legacy for the future. And that may mean sitting on the sidelines this year. And each and every fair has to make that decision, and it's very, very difficult. I've talked with 2 or 3 fair managers just in the past 48 hours who are on that roller coaster of do we go, do we not go, what are we going to lose if we get going and then all of a sudden we're shut down. So some very, very tough times for the industry, and we know that our association's working hard to keep all of our members connected to make sure the folks at the state and provincial associations have all of the resources that they possibly can. The one thing I've been saying to people, because you know sometimes it's hard to be a cheerleader in times like this, and I know that's what my role is supposed to be, but it's a little bit hard to sometimes be optimistic. But I was looking for something insightful to try to share with some folks, and I ran across a Danish proverb that seems to resonate with me, and it resonates with most people. that sometimes it's better to lose the anchor than it is to lose the entire ship. And so we may lose some of those things this year, but staying true to our mission, keeping our brand in the face of the public, knowing that we will be there for generations to come is something we need to stay focused on. So thanks for letting me be a part of what you're talking about tonight. And I'll be happy if anybody has any questions, I'll be happy to address them. Otherwise, I'll just sit back and listen.
All right. Thank you, Marla, for joining us tonight. Please, if you have any questions for Marla, put them in the chat box. We'll kind of circle back around. But we want to get to our guest from the Colorado Department of Public Health and Environment. So, Michael, I'll turn it over to you for the introductions, and we'll go from there.
Okay. Thank you, Marla, and thank you, Jeremiah. We have two speakers from Colorado Department of Public Health and Environment, and I don't know how Eric and Ann planned on sharing their time, so I'm going to introduce them both at the same time, if that's okay. Ann House is the Director of the Office of Legal and Regulatory Compliance for CDPHE for the past 16 years, overseeing matters pertaining to legal services needs, record requests, contracting and procurement, internal audit, privacy, and the State Board of Health. Most recently, Ann has been very involved in the COVID-19 pandemic response and has worked specifically on public health orders, guidance documents, and variance requests. Also joining us is Dr. Eric France. Dr. France is the Chief Medical Officer for the Colorado Department of Public Health and Environment, where he oversees all public health programs. Before joining CDPHE this past February, he worked for the Colorado Permanente Medical Group, the Physicians of Kaiser Permanente for 25 years in a variety of roles, including the Director of Population Health. He is a pediatrician and preventive medicine public health specialist. Ann and Eric, thank you for joining us tonight.
Thank you, MJ. Ann, are you there?
Yes, Eric, I'm here as well, but you please start first.
I'd be happy to. Well, I may start by saying to all of you that Ann House is worth her weight in gold. She has worked for the state 7 days a week, 12 hours a day, I think, helping to create these different variances and public health orders since March. And you should know that she's an incredible, devoted, hard worker for all of us. I'm Eric France, and as Chief Medical Officer, I thought I'd start by saying a little bit about where we are with our COVID pandemic in Colorado. Our first case was on the 5th of March, you may remember, and it was, I think, the 27th of March that the governor's order to have us all stay at home took place, which was in place for 4 weeks. The city and metro area of Colorado Front Range was closed through the 9th of May. So during that time, we were happy to see what began as rather frightening exponential growth in cases that started early to mid-March, quickly plateaued through April, and then has decayed through May. And today, we are at a place where we have a very low rate, day after day, of new cases and new hospitalizations. In my report out to the governor this evening, I heard that we had 3 hospitalizations in the state today, so very, very low. We at our peak had about almost 900 people in the hospital with COVID mid-April, and today there's probably 160 people hospitalized across the state for COVID. And I asked the state epidemiologist this last week, here we are in June, can we now conclude that the work we did of opening things up more safely that started in early May and that we've been doing for the last 4, 5, 6 weeks, is it working? And her answer was yes, it seems to be working. We have not seen the bounce back or increase in cases since we opened up using the safer at home framework. So that's all really good news, and we're certainly tracking at the state how things are going. not only for cases, but also what we're seeing in terms of mobility and how many people are out and about. I would say that just as your previous speakers spoke to how we have to be flexible and we're not quite sure where things are going, we find ourselves in that situation every day where we're looking at the numbers. Is today going to be the day that the numbers start going up, where all the people out and about is actually leading to an increased spread, where the spread that we're seeing in Arizona, where 85% of hospital beds are full, starts leaking into Colorado, and we start finding ourselves on this upward trajectory. We haven't seen it. It's difficult to predict if we will. We do believe that if we can keep people following the physical distancing behaviors of staying apart, not being too crowded in indoor spaces, wearing masks, and if people who are of older age who are at higher risk for complications stay home like they did during the months of April, then finally, if we can build local, strong public health structures so that if there is a local outbreak, we can identify, isolate the individual, identify their contacts, quarantine those contacts to control the outbreak. If we can do all those things, we can keep this pandemic in check. At the local county levels, as we consider opening, we're balancing it with two main issues. The first is there a lot of COVID in the community right now? What is the incidence of new cases? The second is, how strong is the local public health infrastructure? Do you have what you would need should you do a county fair and there are 50 to 100 people and all of a sudden you find 10 people are ill and you have to do all this contact tracing for all the folks that were in contact with them? Is that infrastructure ready to go? And so as we move forward in our planning as a state, we'll be looking at issues of the preparedness for local public health as well as disease incidence. Remember too that influenza, the flu, typically isn't really a pandemic in the summer months. It's a fall winter disease, and we see very low rates now of COVID. We'd like to think that all that we're doing is having an impact. How much of it is actually the biology of this virus? Maybe it's like influenza and is calm during the summer, particularly for people in Colorado who tend to like to be outside and stay apart from each other, and particularly in a time when many of us still work from home or know how to stay socially distant. So our expectation is that it's likely that we would see a rise in September in COVID cases. And we need to be doing a lot of work now to build local public health infrastructure, information, preparedness, the ability to do contact tracing. All that kind of work needs to happen now. And we need to be able to open up our economies to a safe level so that we have some economic livelihood as well in this time period. So our challenge is that if we guess wrong, we could find ourselves going up in cases in July, and we may have to rethink things if it's really spreading like it might be in other states. So it's a tightrope that we have to walk, and I'm hopeful that there's a tightrope that works for county health fairs. And with that, I'll turn it over to Ann, who will speak, I think, more about some of the specifics and how we're thinking around fairs and outdoor groups of people. Thanks.
Hello, everyone. Thanks for having both Dr. France and myself on your call today. I hope I'm able to share information that's helpful for you and for your planning purposes, and happy to take any questions, and those that we can't answer today, we'll certainly get back to you. So the timing for this meeting is quite good, knowing that the state just put out some draft guidance yesterday for outdoor events, which includes the events that are near and dear to your heart, out at fairs. And so hopefully you've had an opportunity to take a quick look at some of those guidance materials. I'm just going to go over it very briefly today. And then, as I said, I'm happy to try and answer any questions. Please know that these are draft materials, and we do have a link, and I can provide it in the chat if that might be helpful, for feedback, for folks to send feedback on these draft guidance documents. Again, enormous lift from a lot of people to get these materials prepared and ready to go, but we're certain that there will be gaps that we didn't anticipate, and helpful suggestions will come from all sorts of folks. So we're hoping that if you see areas where we missed or we're slightly off and need to correct course, that you will help us make this the most usable and user-friendly guidance that we can. Just in terms of process, I'll also note we issue public health orders to go along with updates and changes to whether it's executive orders or the next piece of the Safer at Home framework. And this is hopefully what we believe to be the last piece of the Safer at Home framework in Colorado. So there will be a public health order update as well, and we are timing that to happen simultaneously with finalizing the guidance materials. And so our goal is to have all of that done on Thursday of this week. So it's a somewhat ambitious timeline, but as you know, there have been a lot of ambitious timelines as we deal with COVID response. And the next piece, beyond Safer at Home, which I presume you have heard a fair amount about as well, is the Protect Our Neighbors phase. And there was also a draft framework document issued publicly on Monday regarding that Protect Our Neighbors phase that we are also seeking feedback for. For that piece, we have a longer period of time. So I would really ask, if you are pressed for time, to focus first on the 3 items that were sent out yesterday that update and finalize Safer at Home. So those are guidelines for outdoor events, guidelines for indoor events, and then residential camp guidance. And again, I'm going to focus here only on the outdoor events guidance, just to give you a flavor for what this is anticipated to look like. So in this draft guidance document, we talk about to whom or to what it is applicable, and that includes outdoor receptions, events, fairs, rodeos, non-critical auctions, and I'll stop there because that's a very strange term, but it's meaningful for those of us who have been working in the critical business versus non-critical business arena. So there are some auctions that were authorized, stayed open, were never required to close cultural communities. So critical auctions are not necessarily regulated or instructed to follow this guidance document. Those have been ongoing. This is for those non-critical auctions. So just wanted to make that minor note. Concerts fall in this bucket, and other outdoor venues not covered in other guidances. So one significant difference in the creation of this outdoor events guidance has to do with limiting capacity sizes depending upon the venue size. So as I'm sure you're aware, in prior guidance materials and public health orders and executive orders, the capacity limits, whether it was a percent capacity or a total person cap or both, did not received a lot of feedback about that, understandably so. And in this particular guidance document, as you will see as you look at it, we have made a differentiation between venue sizes. So simply put, there are what we call standard venues, large venues, and extra large venues. At the standard level, that standard venue size is under 5,650 square feet. The capacity limit is up to 50% or 50 people per designated activity. I'm going to come back to that per designated activity component. I just want to first give you the venue sizes. So that's the standard venue. Again, it's under 5,650 square feet. For large venues, which is defined as over 5,650 square feet, those venues capped at 11,300 square feet. Stay with me, I know this gets a little interesting. Those large venues, the middle tier, are also up to 50%, but capped at 125 people per designated activity. And then the last tier, the extra large venues of over 11,300 square feet. Again, a 50% cap or 175 people per designated activity, whichever is fewer. So let's get back to the per designated activity language. So we have also received a lot of comments, again, when speaking about large venue sizes, that the capacity may be significantly beyond what we're allowing in terms of person caps, the 50, the 125, or the 175 here. So the idea was understanding, particularly this time of year, there are a number of outdoor venues where multiple activities may be undertaken simultaneously. And in my mind, I immediately thought of a fair situation where you may have a music stage somewhere, you may have a rodeo ring, you may have other larger scale activities that in a smaller venue might be the sole activity, but when we're talking about something like fair or potentially a stock show, there might be multiple, there might be enough square footage for the opportunity to host what would otherwise be a singular event. So that is why we use language about per designated activity. And it likely will be complicated but necessary for these larger venues to do a significant amount of planning in terms of how to maintain appropriate distancing. So we are still referring back to the need to maintain a minimum of 6 feet of physical distancing between individuals or between groups. So if you travel with your family to one of these events, you need to maintain 6 feet of physical distancing between your family and other individuals who are not household contacts of yours. So again, the thought is this gives, whether it's a fair or another large outdoor event, the opportunity to have more than just that person cap total at the venue. They can have 175 or 125 or 50, depending upon the size of the activity area that's being used for that particular activity. They can reach that cap for the various activities. So I know that's not necessarily easy to explain, but hopefully it makes sense to you that those caps are per event, and then the management will need to include not just managing people who are spectating, who are watching those events, also managing individuals who are participating in those events, again, maintaining the 6 feet distancing that we talk about, use of protective equipment as necessary, frequent hand washing for employees at these events, making sure that we're doing symptom monitoring protocols, including temperature screening and excluding individuals who are symptomatic. So much of the standard guidance that we have applied across all of our settings still apply here in outdoor events. The significant difference is the ability to have larger groups, frankly, in these participating or spectating in these designated activities. And for me, the piece that is critical in devising your plan for management is making sure that as people transition from one activity to the next, that you have good traffic flows in place, you have good directional guidance, you have appropriate staffing so that participants, attendees in these events know how they are supposed to act, where they can travel to from one activity to the next in order to do the best that we can to mitigate disease spread. So that's the piece I really wanted to focus on today because it is significantly different than any other of our guidances that we have previously issued, and I know it might have the most questions associated with it. So I think I'll stop there as I know you're running short on time for your meeting and see if there are any questions. And again, what I can't answer, happy to do a little homework and get back to you.
Thank you, Ann, and thank you, Dr. France. I do have a few questions here that have come across, and I think it's looking at definition of those spaces a little bit. So one of the questions is, a building in a fair may be full of pins, tables, display counters, anything like that. Is the square footage based on the building size or on the applicable size that available size or floor space that attendees can traverse through?
That's a great question. So I'm going to tell you what I think, and I'm going to do a little digging because, again, this is a somewhat new concept. When we've asked folks to plan for 6-foot social distancing, we've asked them to use the space that's available for individuals to use, not the building perimeter, but the available space within the building. However, in this circumstance, I think for purposes of just deciding which grouping you fall into, standard, large, or extra large, I'll get those terms down eventually. I think it might be more simplistic to look at the size of the space and not necessarily the space where people are able to walk or be present in that space, and then calculate the 6-foot distancing based upon the actual available space within that setting.
Okay.
Yeah, so I would ask, give us a moment. We'll just double check. I see there's a similar question in the chat about a venue where there's the grandstands have 9,000 square feet. That would allow 125 people, but the arena itself is 19,000. And, you know, from the idea of infection prevention and control, it's really the 9,000 square feet of the grandstand where people are sitting where you need to think about spacing. And it doesn't seem like you'll have the same kind of potential protection if we're all in one small spot and there's this big open space next to us with nobody in it or very few people in it. So I think it's more likely that we'll be looking at the square footage of the grandstand itself to determine it rather than the whole arena, given the disproportionate distribution of people in that overall space.
Okay, thank you. Will each county have to apply for these, like the variances, or is this going to become a statewide on July 1st?
So in terms of the Safer at Home guidance, which includes this outdoor events guidance, it will be finalized as part of the Safer at Home model. So these are the standard expectations within the Safer at Home model on Thursday, June 18th. So at that point in time, counties can utilize those standards. And if they are able to hold their events within the terms of those standards, there is no need to apply for a variance. What will change closer to July 1st is the rollout of the formal Protect Our Neighbors level within the 3 levels of response and recovery. That will look a bit, it will look significantly different. I'm not going to get into the terms of it right now. And it likely will not have a variance component to it like you are accustomed to seeing in the Safer at Home model. Instead, there will be essentially a qualifying ability for counties to qualify based upon their own specific county metrics. That's how the framework reads, and the variance process likely will just stay in the Safer at Home model for counties that don't qualify yet for Protect Our Neighbors.
Okay. Do we see in the last public health directive, we've seen the specific guidelines that specifically stated not authorized are fairs, rodeos, festivals, and parades. Do we see that going away in this next public health directive on the 18th?
Yes, certainly. With the development of this guidance and finally the framework for how these events could take place safely, we are going to reference that in the public health order and remove the prohibition.
All right, thank you very much. Somebody asked if we have a contested zone, a spectator zone, and a separate, can these be separate, and like biosecurity zone? Can you create different zones for the, like an outdoor arena?
I'm thinking, I'm not quite sure I can visualize that. So if the zones are all, so contestant and spectator, if the zones are all relative to the same activity, then I think they fall under the same activity requirement, meaning the caps, the occupancy and the total person caps would apply across both.
Okay. And do we have an outlook for parades? What are we has that been a discussion at all?
So parades, I believe, also are included in this new outdoor event guidance. I'm going to scroll back up. They didn't specify on this one, but I will make sure I ask that question because it was my understanding that parades would also be authorized in some form in this outdoor event guidance, but I will circle back and get back to you.
Okay, appreciate that. I have a question that I skipped a question and I'm not sure what that question was.
I've got it found, Jeremiah.
Okay,
Rural areas need guidance on a larger than 11,000 square foot area. And I believe they were wanting some guidelines for those facilities that are larger than that area.
So the framework as it's currently built, and I appreciate the feedback, so I'm certainly going to share that. The framework as it's currently built in the guidance puts that extra large capacity starting at 11,300 and anything larger. So there isn't anticipated to be another tier beyond that in terms of if there were a request for or a thought that we would have higher capacity caps or person caps. The highest we have gone at this point is the extra large capacity. And I guess I would ask back, is there a need for additional prevention guidance with respect to these larger square foot facilities? I think there's another question. 33,000 square feet, we can only contain. Got it. So you're looking at the size. Got it. I can certainly provide that feedback back to the team that's going to do the final review on the guidance materials before they're finalized. And I would also encourage, I think someone included it in the chat, I would also encourage you to go directly to that feedback form and provide the same question. Is there an ability for additional individuals if the size of the facility or the area is larger, as in the example that you just provided?
okay. Do we have any other questions for Dr. Franz or Ann? I appreciate you guys being here, and I think that this answers a lot of questions that fairs were having when the last public health directive came out with that specific language. So this is going to help. And we've got a few more questions popping in here. Is a covered barn with outsides considered an indoor or an outdoor facility?
That's a great question. A covered barn without sides. Dr. Franz, what do you think? I think we have concerns about ventilation, obviously, and without sides gives the opportunity for additional ventilation.
I agree. I think it might be considered outside.
Yeah, I think our definition. I think our definition in the past has been 4 walls and a door. So I would argue for you that it might be an outdoor venue.
Okay. Why barrel racing? Would barrel racing in the outdoor arena be counted as a different head count from the grandstand's head count when the separation is over 80 feet? So if you have the event going on, if you have contestants out in the arena and you have people in the grandstands and they're separated by more than 80 feet, does that constitute 2 different areas?
So I don't think so. And again, because the guidance talks about these venues being capped per activity, if the activity is here, I think it says barrel racing, and the spectators are in the stands observing barrel racing, they are all there for the same event. They just are doing, some folks are participating and some folks are watching.
Okay. So we're going to kind of switch, and what, if you guys could fill us in on any thoughts you have about carnivals, and as well as like bouncy houses and more things like that for children. Do you think we can see some kind of a guidance on that? I know there's going to be cleaning recommendations and things like that, but has that been anything that's been discussed?
So I will let Dr. France answer. I've not been in those conversations, and if neither one of us has, I'm happy to take that request back.
Okay.
Yeah, I'd agree. I don't think we've been in those conversations. Bouncy houses and child, we have to kind of think through children engaging and maybe compare it to other settings where we have kids, whether it might be a day camp or child care experience, and try and think about what are the principles we've used there and how would they apply in these different settings.
Yeah, because I think that especially with like bouncy houses and carnivals, I mean, we're getting into, you only can have a small people in those areas at one time. Is it something that maybe we can allow those, and then with the cleaning protocol, every 30 minutes? Does that seem like something that might go along with the day camp kind of activities?
Yeah, we'll have to look into it. I'm not very hopeful, to be honest, knowing how, as a pediatrician and a parent, of course, what the kinds of potential infectivity of children. Of course, the other issue with kids is that a lot of them don't have symptoms when they get this virus, and so they can go around and potentially spread it to others. And so we're being careful with kids. If it was a bouncy house full of 70-year-olds, then maybe we'd know that they're not going to get in there unless they're feeling well. But no, there are specific challenges with young folk where the carriage rate becomes higher and asymptomatic spread is possible.
And I'll make a connection as well to high touch surfaces. And you already expressed the need for cleaning and disinfection, but a bouncy house, and Dr. France has already expressed some concerns there. A bouncy house is an incredibly high touch area that might be difficult from just a perspective of continuous use, might be difficult to accomplish adequate cleaning and disinfection between uses. And analogously for sporting events, for example, we have put out a lot of guidance that talks about bring your own equipment, don't share equipment. I mean, there are certain mechanisms that are helpful in trying to prevent spread of disease, even if you are participating in some higher risk activities. And one of the basics has been use your own equipment, don't share, don't bring high touch surfaces into the equation if at all possible. So I hear Dr. France, and I would have a lot of concerns about purposefully putting out a surface that is intended to be high touch likely without the necessary cleaning between uses. Absolutely.
Well, thank you for that. One more question here. Do you think that any food vendors that attend a fair, will they basically need to follow the same guidelines as food trucks and takeout restaurants at this point?
I'm taking a quick peek. That makes perfect sense to me. I'm looking to see if we addressed it at all in the draft guidance. Frequently, we will refer to other relevant guidance documents for the activities that are described, but I would be curious. So it sounds reasonable to me, but I would be curious to know if it sounds reasonable from your perspective.
Okay. We have a comment here just for consideration, maybe, as you guys are working these. There's a huge difference between spectators and participants in almost every activity area that a fair might have. In almost every instance, each type has their own activity space, and the two do not cross or commingle. It seems reasonable that each should be considered separately. Might be worth a second look before finalizing.
We'll certainly take that feedback back.
We appreciate that.
Yeah, that's a good thought. Thanks.
I do see some that are, the carnivals are adapting Disney practices, and I'm not completely up to date on what Disney practices are. I know that they are very strict, so it'll be nice to see what these carnivals are doing on their own to make these rides safer. Do we have any other questions for Dr. France and Ann?
Well, I'll just say I'm really appreciative of all the thought you guys are putting into this and the careful approach you're taking, which is, I think, what's really going to help us through all of this is when you see the individuals and the businesses and the organizations taking it really seriously and behaving appropriately. That gives me hope. I believe the requirements, for example, are that folks wear masks, would be required to wear masks. And I think that would be very important, both for the safety of everybody there and just to be sure that there aren't any stressors in the participants of some people not wearing them and some people wearing them and causing tensions or something because of that. So thank you for all you're doing to think this through in a serious, thoughtful, and safe way to protect the potential folks who would be coming out to join these fairs.
We appreciate that. I do have one more question that came in privately before we kind of open it up to questions to all the speakers. If a fair goes against these guideline recommendations, what consequences do lie in there, and where would those consequences come from, and who would be responsible?
So the public health order will contain the requirements for all of these different activities, whether it's outdoor events, indoor events, any of the other activities. Public health orders have the force and effect of law. And so entities that choose not to follow those requirements, I'll use some restaurants as an example. As I'm sure you all know, both state and counties have taken actions against restaurants that opened contrary to the public health orders. Those are a little more complicated because it could also include a license suspension or revocation, but on its face, legal actions have been taken either at the state or county level to enforce, typically starting with a cease and desist order to the activity, event, business, what have you, that is not in compliance. And if the cease and desist order is not effective, if the event or activity or business continues in violation of the order, then that can also then end up in a filing in a state district court case against that operator, for lack of a better term. So, and again, that can occur at either the state or the county level.
Okay. And so many of our fairs are made up of fair boards. Would that fall back onto the individual members of the fair board or just the organization as a whole?
I have not thought about that. I think we would have to discern where we thought the violation was occurring, in what capacity. So I think we'd have to have an understanding of if hypothetically a fair board said, I don't like the requirements in the order or the guidance, and we're going to operate our fair differently. There might be a cease and desist issued to the board itself. If it's an individual, for lack of a better term, because I don't know your world very well, if there's an individual operator within a fair that is solely in violation of the order and no other portion of the fair is, I think it's possible to pursue that individual operator. So I think it's really, I hate to say it, but it's the legal answer of it depends, and it really does depend on the facts and circumstances.
Well, we appreciate that. I know it's a tough area to be dealing with right now. We're going to open it up and have questions. I did see that Dr. France had to leave us. We do appreciate him. And I want to thank you very much for joining us here. We're going to kind of open it up to questions to call on all of the speakers. I'm going to hit you with one more real quick, Ann. Has there been any limited food for food vendors inside buildings? Has that been into an issue, or does that just fall into the number of people?
So I want to make sure I understand the question. Limits for the number of individuals who could be in the food booth preparing food?
I think what they're wanting is there going to be a limit on the amount of actual food booths that are allowed? Or would it come down to who all can fit in that area inside those limits?
I think it's the latter. I think it's how many can fit within the parameters described, not a proscribed number of food booths.
Okay. I just wanted to clarify, but I think that's kind of what I was thinking too. So, a question for Ashley. How much will extension staff be allowed to participate in fair activities? And is CSU allowing 4-H leaders to have face-to-face contact yet?
Yeah, so yeah, thanks for that question. So we're following the local county public health guidance, and so if that allows for there to be the youth activities there and extension types of activities there, then we can definitely be involved. I mean, I think there are limits to, I think just like what Scott defined with State Fair, there are some activities that we're not able to do as much in a face-to-face capacity. But we have been really working through those protocols to where we can have some of the activities face-to-face, and so then our agents and some of our specialists and volunteers are able to participate. But at the end of the day, it really depends on the local public health guidance, and if we're able to participate. And thank you, Anne. Really appreciate your comments. I really appreciate all the time and hard work you put into that and thought into it, and it's very complicated. And I think you hear how much everybody is looking to y'all for guidance. So thank you so much for that. But that's how we're approaching this, is just to follow that guidance really closely. And so as long as we can do that, then we can participate. As far as our face-to-face, what we've been doing is we've been working through county by county and using that public health guidance, and then working with 4-H or with other activities too that we have, and working through the public health guidance and making sure that we can follow that and maintain safety. Safety always comes first for us, of course, with our youth, as and all of our programs. And so we've been able to have some face-to-face types of activities as long as we can follow that guidance. And so we've been doing that county by county. We review all of them just to ensure that that safety can be maintained. And of course, with our 4-H activities, I mean, the safety aspects go beyond that, related to this public health. So we're just ensuring that that we can follow that type of guidance, as we have our activities.
All right. Thank you, Ashley. For Anne, what legal liability does the county have if the fair has done everything a reasonable person would do to follow the guidelines/orders, but people attending the fair do not follow the rules?
So I'll add my friendly legal disclaimer that I can't provide legal advice.
Yes.
I tell my own agency that as well. But it's a great question. And again, it would likely depend on the facts and circumstances of, you use the right legal phrasing, what would a reasonable person do, right? That is a legal standard. So I think it would depend upon the extent to which the county prepared and put in place a reasonable plan, hopefully worked closely with their local public health agency to ensure that they had reasonable plans in place to ensure, to the best of their abilities, that all of the requirements were followed. Appropriate social distancing or physical distancing was marked throughout the event space. There were signs available for individuals to read. There were masks required to be worn. There's hand sanitizer available. There's a limit, there's a capacity limit at each activity that is enforced, that is followed. So I hear you, you can have the best laid plans and someone will come in and try to disrupt them. And I think if you have set your position well in terms of a well thought out plan that's been reviewed and approved by your health agency and you implement it, I think you are in a much better place in terms of any outstanding liability.
All right. I appreciate that very much. Right now, I've not seen any other questions come through. I want to say thank you to Ashley, Scott, and Dr. Franz, Marla, all for your input tonight. And I'm going to turn it back over to MJ for the evening.
I got to admit, you caught me off guard. I didn't see that on the schedule. So I also want to thank all of you and Eric. That was great information that you were able to provide to our people. Marla, we always appreciate having you. Ashley and Scott, thank you for the updates. And Scott, congratulations for getting to move forward. I had the opportunity to watch your Fair Board meeting. Thought you did a nice job. So I say thank you for everybody joining. Do we need anything else from CAFS?
I think we are good to go. Once again, I appreciate all you guys joining us. And hopefully you guys, everybody can come to a good plan, and good luck with everything. So thank you. With that, we'll have a good night.
Appreciate it.
Ashley, or excuse me, Angie, you want to stop the recording so you don't have to edit all that off?